So Venetoclax has made a big impact in older patients with acute myeloid leukemia. The number of older people getting acute myeloid leukemia is potentially increasing, and by 2050 there'll be 2 billion people over the age of 60, and it's estimated that 1 in 500 people per year will develop AML ultimately. So new therapies in this area are extremely important. On November the 21st, 2018, Venetoclax, an inhibitor of BCL-2, and also another drug called Glasdegib, which is a hedgehog inhibitor, were both approved for older patients with acute myeloid leukemia unfit for intensive chemotherapy. So these two drugs represent potentially the first major therapeutic breakthrough for older patients for many decades. With respect to Venetoclax, this drug was approved on the basis of 2 clinical trials conducted in older patients with an average age of about 74. With Venetoclax, it was combined firstly with hypomethylating agents, and the major results from that were a response rate of 71%, and at 12 months those responders, 70% were still alive. Similarly, in patients with Venetoclax receiving that drug in combination with low-dose Ara-C, the response rate was 54%, and again a very similar 12-month survival of 70% amongst patients that responded. So really this sets the benchmark for how future therapeutic development should occur, and the question now is, for those patients that don't respond initially to these combinations or who relapse, what will be the next therapeutic steps forward. So some analyses that we've done from those studies suggest that patients with NPM1 and IDH mutations in particular seem to have a very good response rate and also long-term survival. However, other patients who have activating kinase mutations such as FLT3 or who have complex or adverse karyotype, often in association with P53 mutations, these patients may not do as well. And so the key question is what drugs would be most effective against these populations. So really at this stage new trials are just being formed. There are no results from these trials yet, but with respect to patients who have activating kinase mutations, the potential for triplet combinations with low-dose chemotherapy plus Venetoclax in combination with, for instance, a FLT3 inhibitor are being developed. And in patients with P53 mutations, this is a much more challenging group of patients, and really there's some possibilities of combining Venetoclax with, say, histone deacetylase inhibitors, and also possibly a new drug called APR-246, which seems to have activity in patients with P53 mutations. So it'll be interesting to see what happens when results from these new novel combinations come to bear.